This is Bill Boerum, and I'm at the UC Irvine 26th Annual Conference on Healthcare Forecasting. And I have with me Joe Antos, who is a scholar at the American Enterprise Institute, one of today's presenters, that all of whom addressed a number of pressing issues from different perspectives. So I'm going to ask Joe a question that I think many people have had an interest in. What would be, to your point of view, those common areas of interest or collaboration between Republicans and Democrats as they try to find common ground in the repeal, replace scenario?
Thank you, Bill. That's a great question. There's no question in my mind that Republicans and Democrats agree that everyone should have access to health insurance. Where the disagreement's going to be is precisely how you do it, how much of it should be Medicaid, for example, how much of it should be private insurance. They'll have disagreements also about the level of subsidies, but there's also general agreement that people who are buying their own insurance on the individual market need some help from the government. So these are two big areas of agreement. Beyond that, I would say that they have one other common concern, which is they all want to be reelected. And so that doesn't mean that Democrats will move in one direction and Republicans go the other way and they won't make a deal. I think that there's a chance that this fall, Chuck Schumer, who's the leader of the Democrats in the Senate, may find it reasonable if Republicans propose a reasonable set of changes and also package it with some other things that Democrats really want. I think the infrastructure bill, for example, that people are talking about has going to be something they're going to want to do as well. And I think they're going to coalesce around something like that. If they don't, then I don't think there's going to be any legislation this year.
Well, thanks very much, Joe. I think that's a very realistic assessment of the situation. And thanks very much. Again, enjoyed your presentation today.